Hi, everybody. We are Cindy Lewis Caballero and Sandy Orlando, your two co-race directors of the upcoming Nutrients Oakville 21.1 half marathon 10K and 5K taking place in Oakville on September 29th. With us, we have Dr. Inoue-Cheng, a dentist from Oakville from Flow Dental Care. And she's a little bit different than your traditional dentist. She's an airway-centric dentist who focuses on the whole body. And we wanted to give Dr. Inoue-Cheng a bit of a chance to explain what that all means and how she can help you guys out.
Well, understand that the mouth is pretty much part of the body, right? And the size of the mouth will dictate the breathing. So this is very important for an athlete, especially when we are talking about a high performance athlete. The breathing is the most important piece. Forget about the drinking, forget about the eating. We all know that we can go days without eating. Water, yeah, but breathing, not even seconds. So it's important. If the mouth it's not the right size or the right position, it will affect everything that comes after that. It's the same line. Start from the nose, mouth, stomach, and guts. If I am dealing with a patient that has a very crooked teeth, that will tell me about the size of the nose. So it's not about alignment. So this is one thing. So right there will be an athlete that will probably, he might succeed, he might reach his goals, but he will have to work harder because now he's doing a shallow breathing. It's not like the entire core. So this is important to think about it. The other aspect of the size of the mouth, it's the position of the jaw. The more push back, and as an Asian, I can say that my genetic, it's a flat face. So my jaw, both top and bottom, will be a little bit more on the pushback. That might dictate the size of my airway behind my mouth. So those are the things that a dentist can help. Not only that, if I am mouth breathing for whatever reason, the size or position of jaw, teeth, then I will dictate the microbiome of my mouth. And like I said, everything is connected, right? Nose, mouth, stomach, and guts. Right there, I might have a patient that will be more prone to have some lung issues or breathing issues. All this dictates a lot. If I go a little deeper on the whole body approach, again, if I'm dealing with someone who is mouth breathing, they might not be absorbing vitamins the way they're supposed to. And we all know that an athlete will use energy in a different way, right? So absorbing, using, and detoxing, they are all three things very well connected that sometimes we don't think about it. We just go by the fact that we need to eat health. We need to eat the right amount. But again, it's all connected. If I'm putting in, but I'm not absorbing proper, then I might not detox as well. So we have to look to the entire package. As a dentist, I know for a fact bacteria in our mouth, it's the good and the bad. It's about the quantity, the kind of quality and quantity inside of our mouth. It's so funny. I hear so often patients coming to the practice and we ask what's their home care routine for oral hygiene. And when I ask about flossing, there's always the funny answers or the lack of answers. And you know what that means. They don't have a very good oral hygiene, but they don't realize that a simple gum bleeding, it means inflammation, and that will dictate their heart condition. A lot of patients might develop some heart disease because of periodontal disease, gum disease. Bleeding gums, it's periodontal disease. I think the best way for patients to understand in a very simple words, if you wash your hands, does your hands bleed? That should be the same to your gum, right? So there's so many little things that we can talk that would help an athlete. So start from the lack or the proper oral hygiene that will affect the microbiome, that will affect the absorption, the size of their mouth. Forget about alignment. Not that I don't care about alignment, but in my practice, it's very important that patients understand it's four corners that a dentist should be tackling when he meets a patient. It's the skeletal. So size, position, shape of the skeletal dictates a lot. Number of teeth, shape of teeth, muscles, and how they're going to use all together. Because if I have one or two of the three items, correct, but I don't use together all proper, things will fall apart. It's just like going to your practice. I have neck pain, and suddenly Dr. Cindy, Dr. Sandy fix my neck, but I have a short muscle, short ligament that will relapse to the wrong side, right? Uh, uh, um, One analogy that I use quite often to my practice, if I have a canted smile, if I have a crooked smile, it will dictate my TMJ, my bottom jaw, that will dictate the spine, something that you guys take care of way better than me for sure. So those are the things that a whole body approach or air-centric dentists can look after and coordinate with patient and different providers to take care in a more wide perspective.
So how did you get into this type of dentistry, and did you have any difference in education from the traditional dentist that I would go to?
Yeah, thanks for asking. I keep joking that I'm not a slow learner, but I feel like the more I learn, the more I need to keep going more and more and more, right? Like I know nothing. I actually am a former dentist from Brazil, so I'm a Brazilian dentist. I took my training for dentistry there. After finishing my graduation, I decided to become a specialist, a root canal specialist. Yes, you guys are hearing my dog. Sorry. Hey guys.
We love dogs.
Guys. Um, and moving to Canada 18 years ago, I have to go back to school. But I told my husband that I never would go back twice to dental school, become a GP and then a specialist. Well, I think he knew me better than myself. Yes, I became a GP, but I realized very after practicing as a GP that I was missing something. I was practicing BC. I actually moved from BC 5 years ago to open my practice here. But back there, I saw a lot of patients on the very health kind of end of patients, doing everything right, nothing like that I could change, but they would come to my practice with cavities, to my practice with TMJ disorder, things like that, or bruxism, like grinding their teeth, clenching their teeth. And I start questioning myself what I'm missing here, because as a GP, you kind of have to be a superhero. You have to know everything, right?
Mhm.
So yes, then I decided to go back to school, and I took further training. It was an eye-opening for me. Breathing, pretty much the way we breathe, it will dictate and will maintain the health of our, not just the mouth, but the entire part of that comes behind the mouth, the body. So pretty
Mhm.
much that's what happened. Um, it might be a foreign kind of topic for a lot of dentists because we've been trained to be perfectionists and we focus very much in teeth. And sometimes it's quite easy to focus on teeth because it's already so complex. Just focus on teeth that sometimes we forget that behind the teeth there's a tongue, there's a cheek, there's a human being, right?
Mhm.
It was a lot of training, and I have to say it's a continued training because every patient is a different patient. Every patient comes with different signs and symptoms. They might have the same cause, the same problem, just like you guys, I'm pretty sure, right? uh Torsion head or torsion neck might look the same, but the reason might be different, right?
I know that like in my practice, if someone came in with a sore neck and I just fixed their neck, it would be way less likely to stay better ongoingly, right? You have to treat all the other connections like you do as a dentist.
Yep.
I think for, in this part of the world where we think of our bodies as segmented, that's how we're that's how we're taught to think of them. And they're not segmented, right? It's all one piece. Everything works together. There's a lot about us and our bodies that we don't know, but there's a lot that we do know. And we do know that one piece of us doesn't work without any changes of the rest. So what you're saying makes sense to me, and it's really amazing. I really enjoy hearing you talk about it. I can hear the passion behind your voice as well, which when you're passionate about something, you're good at something, right?
Oh,
I
I
think you
will take it.
don't become the best at something without having that kind of passion. If I walked into your office as a patient, would it look the same as everybody else's office, or do you have any types of tools and technologies that your traditional dentist may not have?
I like to think I'm a dentist. I'm not different, but yes, of course, if I'm honest to myself, um, we take the pride. We have lots of I call tools and toys
Mhm.
because I want to make sure that every patient that walks into my practice, they have the convenience of all kind of treatments, the highest end as possible. We have lots of technology. we have equipments that not necessarily I do have to take x-rays, but I can keep like in between, let's say, a more risk cavity patient, I have to see with more frequency, but not necessarily I have to do x-rays. In between, we can do different technologies that I can kind of keep doing follow-ups without radiation. But on the other hand, I do have CBCT, which is a 3D image in my practice, so we don't have to send patients outside. What else? We have one-day crown in the office, which means it's one-time appointment. I think my favorite toy in the practice, it's the laser. We have a very cool laser that it's using every single corner of the health field. I pretty much I can do everything with that laser. And for athletes in particular, and I do have some high-end athletes in our practice that come specifically for this treatment, is to help on the breathing. They are very good in the market for snoring, and I like to educate my patients what snoring means. It is a symptom for breathing and sleeping disorders. And I think one piece that most of the patients, when they ended up in our practice, has no idea about it, it's that it's more than 20 different kinds of breathing disorders. Like I said, snoring is just a symptom, but it could be a symptom for many different breathing disorders. And that's something that I take the pride. We take time, we explain to the patients, we do our head and neck exam like any other dentist. We go after cancer, cavities, periodontal disease, so on. But we can offer different treatments, right? And the laser is one of them. I really enjoy using my laser to help not only on the breathing, but the sleeping. I'm sure you guys see a lot of patients with TMJ disorder. Yeah, so it's one of the things that I can do with laser. So it's pretty cool.
Great.
It sounds like there's a lot of education that needs to be done for people generally if they're not familiar with this kind of dentistry, and particularly as athletes. And is that a big reason why you've decided to partner with us for our race, just to help educate athletes?
Pretty much. I feel like it's not one thing that will make someone healthy. A lot of times I see patients tackling, oh, it's the vitamin D, or it's the organic food, or it's the water, the quality of, oh, no, it's the whole package, right? And exercise, we all know that exercise is a big deal. We all have to do a little bit of our share. And it, like you said, education, pretty much. Education is a big deal. And once we as a health providers and patients understand that we all have our role in this kind of picture, I think then we are aiming to be healthier as a community, not just as a person, right? I think the world is going through so much lately. I think we really have to hold our hands and help one another, even if it's just with education.
Yeah. And where is your practice? Where do people find you?
We are located in Oakville, 1 block away from Oakville Place. So there's apparently it's a very easy location. Although coming from BC, I wasn't sure that it will be that easy. I'm still kind of learning my ways in Oakville, but yes, it's 1 block away from Oakville Place.
Perfect. And it's a beautiful practice. I have been there, and
Thank you.
beautiful.
Appreciate
So
that.
you've done a great job there. Great. And you or someone or some of your team from Flow Dental Care will be on site at the Oakville 21.1 in September.
A few.
So that's amazing. So people could come over and talk with you and learn, some more information about what it is you do if they would like to do so. Is there any other way? How would they call if they wanted to make an appointment?
I think the best way to reach us out is going on our website, so flowdentalcare.ca. It's a good to understand how and what kind of things we can provide in our practice. And from there, you can find an email and phone. I think that's the best way, the website.
Fantastic. Great. Thank you very much for coming on with us. I think it's really, really interesting to do. And I think
thanks for all the work with the run. I'm excited.
Yeah, you're welcome.
We'll be encouraging all of our
something like you exists. Go ahead, Sandy. Sorry about that.
Oh, sorry. I was going to say that we'll be encouraging all of our athletes on the course because we understand you'll be at an aid station. So show you their smiles.
Absolutely.
Perfect. Well, thank you very much for joining us. And we look forward to seeing you soon. And to all of you that are watching, we look forward to seeing you soon in Oakville on September 29th. If you haven't yet registered for the race and you would like to, you can find a link to register at www.enduranceeventproductions.com. Have a fantastic day and happy running.